Cataracts are problematic in their effect on vision, but it is great news that generally speaking, we can improve the vision when we remove a cataract. Aside from the wonderful impact that cataract surgery can have, I want to share with you some of the fascination of being able to look at different types of cataract. In this video, I'm going to show you some of the more common cataracts and also some of the more interesting types. When you've seen your eye doctor or optometrist, you can ask them which one you have. So firstly, let's look at a normal lens. The lens sits just behind the iris and pupil, and it is suspended here by some tiny elastic ligaments. Let's remove this lens and have a closer look at it. This is a young lens, so it is clear. It lets light through very well. With age, the lens becomes a bit more yellow. This is normal. Now let's look at some cataracts. One of the most common cataracts to get as one gets older is a nuclear sclerotic cataract. This is where the center of the lens, the nucleus, becomes more dense, more hardened, more sclerotic. This tends to cause more short-sightedness and also some haziness to the vision. Another type of cataract is this brown or brunescent cataract, which is a very advanced, dense cataract. And this will cause a lot of blurring. Another very common type of cataract is the cortical cataract. The cortex refers to the part of the lens just inside the outer elastic capsule of the lens. You get these little spokes, little radial white areas. This looks dramatic, but actually often the vision isn't as affected as you would think from looking at this until the cataract is quite advanced. Another very common type of cataract is posterior subcapsular. Posterior means at the back of the lens. Subcapsular means that the cataract is just within the capsule. Even though often these posterior subcapsular cataracts are very small and they look pretty innocuous, they have an outsized effect on the vision. They are right at the back of the lens where the light rays come together, and so they cause a lot of blurring. And particularly they cause a lot of glare for driving at night when looking at headlights. Next is the white cataract. This has a big effect on vision and often comes on quite quickly. Next is the blue dot cataract. This is a less common type. Next is the Christmas tree cataract. This is one which I find beautiful to look at because it has tiny little reflective crystals in it which give different coloured light depending on the direction you are looking at it. And they look a bit like Christmas tree lights. Next is quite a rare one. This is a Morgagnian cataract where most of the inside of the cataract is white and liquid, but there is a central brownish cataract which floats freely within the capsule. So if we move this lens upright, you can see how the central part floats to the bottom with gravity. Here is a cataract nigra. This is a black cataract, which is not very common and needs special surgical techniques to remove it because it is so hard. It's like a rock. Finally, this is the plastic lens that we put into the capsule to replace the cataract. And this is what gives good, focused vision after surgery.